When I came here, I was immediately struck by the relationships people had with each other and sort of the camaraderie among the fellows, but also the way the fellows interacted with the staff. I think the fellowship here really trains you to be an excellent, well-rounded hematologist oncologist. And so certainly being in a referral center like this, you see all sorts of different cases, from the bread and butter, everyday stuff that you would see in a clinic setting, all the way to the very complicated patients who've had every line of treatment possible, who are looking for the latest and greatest clinical trials or novel approaches to things. And you also get to work with well-known, world-renowned clinicians. And so there's nothing that can substitute for that clinical exposure and clinical experience. But then you also get exposure to all the research aspects. So you get to see that translated into clinical practice, and you also get exposure to how these clinical trials are developed, and sometimes actually get to be a part of the development of those clinical trials. Our fellows rotate through a variety of inpatient and outpatient services, which are designed to give you exposure to sort of all the elements of oncology. And so you get to see all of the complications of cancer, new diagnoses of cancer, complications of therapies, and then how you manage all of that. The other thing the fellows get exposed to on those services is either running a team in terms of the consult services, where those teams really are your own, and you're helping the patients get through their hospital experience. And then also running a team in terms of the other services, like the leukemia service and the BMT service, where we have lots of nurse practitioners or physician's assistants. And then from the outpatient side, fellows can rotate through any of the solid tumor clinics. And there are also benign hematology rotations. So that's something that a lot of our fellows will see if they go into community practice or private practice. And then lastly, there's a bunch of clinics that are in our malignant hematology space. So those leukemias, lymphomas, but now on the outpatient side. So between all of that, fellows really get exposed to a number of different career tracks that they might decide fit them well and is maybe what they want to do lifelong. I think mentorship is one of our greatest strengths in this program. You know, our faculty members love education. That mentorship really extends through tough clinical cases, tough research questions and research development, but also those professional development steps, the work-life balance pieces, you know, how do you maintain your own sanity as an oncologist when the work is tough. I would argue that you could get great training in many places, but the environment that you train in and the way you relate to your colleagues and your mentors is particularly unique. And so I think that the fact that our fellows really enjoy spending time together, get together socially, find outlets to vent on the tough days and celebrate the good days, I think that's a sign of a really healthy fellowship program, and certainly something that I see every day among our fellows.